Peptide therapy is a new emerging science in medicine today, and I want to share with you how we at AustinMD are using peptides to help our clients. The first question I get is, what's a peptide? Well, a peptide is a chain of amino acids. And the second question I get is, what's an amino acid? Well, amino acids are the building blocks to our proteins in our body. A peptide is then a short or long chain of amino acids that are commonly thought of as small proteins. Well, what do these peptides do? They're thought of as signaling agents. I think of it like when I come to an intersection, I see a green light, I'm going to go. If I see a red light, I'm going to stop. It's the same type of concept with peptides. They're signaling and talking to our cells and our molecules to help them to function and work better. So sometimes our peptide pathways don't function very well. Other times as we age, unfortunately, these pathways decrease in functionality. So by utilizing peptide therapy, we can restore and optimize our peptide pathways. So what kind of things can I use with peptide therapy? One of the most common things is with injuries. So tissue and muscle repair that we experience when we experience a trauma, when we fall or hurt ourselves in some manner. Other things we can use: age-related osteoporosis, immune system issues, low libido, even neuropathies. So whether you're struggling with some kind of injury that's not healing, or you just want to age better, call us at AustinMD and learn how peptide therapy can help you.